Welcome, everyone. Today, we are going to talk about the treatment of midshaft clavicle fractures. Dr. Bill Robertson, the head team physician and medical director of the Dallas Stars NHL Hockey Club at TMI Sports Medicine in Dallas, will be sharing his expertise on this topic. This video will provide valuable insights into the best practices for managing and treating midshaft clavicle fractures. So, sit back, relax, and get ready to learn from one of the best in the field. Now, let's delve into the anatomy of the clavicle. The clavicle can be divided into three segments. Firstly, the medial segment, which is the closest to the center of your chest. Then, there's the lateral segment, also known as the distal clavicle, located at the far end near your shoulder. Lastly, the midshaft segment, which is more towards the center portion of the bone. Interestingly, the midshaft clavicle is the most common location for fractures, constituting a staggering 80% of clavicle fractures. Understanding these segments is crucial for comprehending the complexities of clavicle injuries. 30 to 50% of all clavicle fractures occur during sports participation. It's interesting to note that boys ice hockey players have the highest incidence of clavicle fractures among U.S. high school athletes, while for girls, soccer players top the list, followed by lacrosse and then basketball. These statistics highlight the importance of understanding the risks associated with different sports and taking appropriate measures to prevent such injuries. When it comes to non-displaced clavicle fractures, non-operative treatment can yield excellent outcomes, especially for younger athletes. This typically involves sling immobilization for 3 to 4 weeks, followed by a guided plan for rehabilitation and continued healing. Before getting back in the game, it's crucial to watch for signs of radiographic healing, minimal tenderness at the fracture site, complete range of motion, and normal strength compared to the other side. However, it's important to carefully weigh out the risk of refracture, taking into account individual patient factors. On the other hand, displaced fractures, especially those with significant displacement or shortening, often require surgical treatment. When considering operative fixation of displaced midshaft clavicular fractures, the benefits are clear. The Canadian Orthopedic Trauma Society's 2007 randomized trial revealed lower nonunion rates, better functional outcomes, improved cosmesis, and greater patient satisfaction. Additionally, patients can expect a quicker return to school or work, often experiencing less pain following stabilization, which means less reliance on narcotics. Operative fixation also facilitates earlier initiation of range of motion and a quicker return to competition. These findings highlight the significant advantages of operative fixation for displaced clavicle fractures, ultimately leading to improved patient outcomes and satisfaction. Let's dive into the outcomes after treatment of midshaft clavicle fractures in NHL hockey players. In a retrospective evaluation spanning 7 years, 10 displaced fractures were treated with surgery using a locking plate and screws. These players experienced an average return to play of 9.3 weeks, with no complications. On the other hand, 5 players with non-displaced fractures were treated non-operatively, resulting in an average return to play of approximately 14 weeks. Notably, 1 refracture in this group required subsequent surgical management with a plate and screws. This chart provides a nice summary of contact athletes who were treated operatively with plate and screws. In this study by Ranaletta, 25 out of 26 high-impact collision athletes were able to return to full sport participation at approximately 10 weeks post-operatively. Maesterling performed a study of NFL football players with an expectation that they would return back to full sport participation at 12 weeks post-operatively. They actually found that following plate and screw fixation, 23% other athletes were able to return to sport in less than or equal to 6 weeks, and an additional 67% were able to return to sport in less than or equal to 12 weeks. Finally, a study by Lindemann looked at 90 adolescent athletes treated with plate and screw fixation of displaced midshaft clavicle fractures and found that 100% of the athletes who desired to return to sport did so within 2 months following surgery. A systematic review of midshaft clavicle fractures nicely summarizes the results. As seen circled in yellow, Both non-displaced clavicle fractures treated non-operatively and displaced fractures treated with plate and screws can both be expected to return to sport around 10 weeks. However, in athletes with a displaced clavicle fracture that were treated conservatively, there is a significant delay of 5.25 months before these athletes are expected to return to play. It should be restated that the risk of refracture following conservative treatment of a non-displaced fractures is not insignificant and can be as high as 20% risk. This would then likely necessitate plate and screw fixation at that time. This study provides valuable insights into the management and rehabilitation of clavicle fractures in contact sports, offering important considerations for healthcare professionals and coaches working with these athletes. Understanding the outcomes at different time points can help in developing tailored treatment plans and optimizing the recovery process for contact athletes. As you can see, midshaft clavicle fractures are quite common, especially among certain athletic groups. When it comes to treatment options, the displacement of the fracture often dictates the course of action. If you're interested in learning more about clavicle fractures and other shoulder injuries or conditions, head over to billrobertsonmd.com. There, you'll find a wealth of information to help you better understand these issues and make informed decisions about your health. Remember, knowledge is power when it comes to managing your well-being. As you wrap up this section, it's crucial to remember that seeking professional medical advice is essential for personalized diagnosis and treatment plans. Always consult a healthcare professional to ensure you receive the best care. If you have any doubts about your diagnosis or treatment, don't hesitate to seek a second opinion. It's your right to be fully informed about your health. Additionally, regular follow-ups with your healthcare provider are vital to monitor the progress of your treatment. Your health is a priority, so stay proactive and engaged in your care.